Okay, Paula, let's talk a little bit about working with families of children with disabilities.
I notice a lot of your questions centered around working with families, and that's really important, especially in early childhood special education, because you all who work in early childhood special education or just early childhood in general are on the front line. And very often you are the ones who may say to a parent, we suspect that your child may have a disability and we would like to move toward an evaluation. It's really hard for a parent to hear, especially if they are completely unaware that their child may have a disability. So be prepared for a lot of denial, and I don't think so, and I'm not really sure about this. So that's normal. No one that I know in my 38 years of teaching has ever wanted their child to have a disability. So we need to be honest and upfront, and yet highly respectful of how the parents feel. So we need to put ourselves in that parent's place when we're trying to discuss this with the parents. One of the questions that you asked was, how do we communicate with the parents? And the first thing I want to say is be honest, and then have all your ducks in a row. If you suspect that a child has a disability, or even a delay for that matter, it shouldn't just be an offhand comment. You should have some observation. You should have some early childhood goals in mind that perhaps the child is not achieving. And you should know those child development milestones so that when a parent says, what do you mean my child isn't progressing like every other child? That you're not hemming and hawing around, you can actually tell them, well, most children by age 3 are speaking in 2 and 3 and 4 word sentences. Your child is uttering 1 word at a time, so that that parent knows exactly what you're talking about. Then if the parent says to you, oh, I would really like for you to work a little more with my child, and then we'll talk about this later, the response should typically be yes, because the state of Missouri, as well as all other 49 states, are looking at what we call response to interventions. And what that means is we're going to give some interventions for the child that we may suspect has a disability, and we're going to see, does that child respond to interventions? If we talk to the child individually, are they more likely to talk than when they're in a group? Does the child understand certain vocabulary words? Or if you're looking at motor development, can we teach the child how to run and jump? Can we show the child that skipping is different than galloping? So that would be interventions that you, as an early childhood educator, might employ to see, does this child truly have a suspected disability? Because we're working with little kids and we just may not know. The time frame for interventions is 6 to 8 weeks. So we're not talking about let's do this 2 or 3 times and go on. Document, document, document. And you all in Head Start know that. You work for the federal government, so you're already used to that. So do some observations. I worked with your child for 15 minutes. We threw the ball. Their eye-hand coordination, they could not catch the ball 3 out of 5 times. And if you do that for 6 weeks, then there may be some eye-hand issues. You know what? It may be that they just need glasses. So always remember to check those physical things as well. What's their eyesight? What's their hearing? Children who have speech articulation problems very often have hearing problems. Maybe you have a child with chronic ear infections. That will certainly impact that speech development. So check all of those things before moving toward the evaluation process. One of the questions that you ask is, what are the major components of that IEP? And the first thing that we have to do before we can even develop an IEP is move to that full-scale evaluation. The full-scale evaluation has to have a measurement of intellectual ability, or IQ. For children as young as you all are working with, that's the WIPSI, which is the Wechsler Individual